Today, I am honored to welcome a truly exceptional global health leader, pediatric oncologist, scientist, educator, innovator, and changemaker, whose career already spans more countries, institutions, and the full spectrum of health governance than most achieve in a lifetime, and all before the tender age of 40. From frontline clinician to national reformer, from researcher to regional coalition builder, from international scientific leader to global communicator. Please join me in welcoming the distinguished global health leader, Dr. Gevorg Tamamyan. Dr. Gevorg, welcome to Global Health Podcast.
Thank you so much, Your Royal Highness. It's a great honor being your guest.
It's an amazing honor. Dr. Gevorg, I think I got to know you, I believe, in 2015. I think you were introduced to me during the IR conference, the International Agency for Research on Cancer. You were introduced to me as a young global cancer leader. And since then, we became colleagues, partners in various initiatives, and then, of course, we became friends. And prior to this podcast, I thought I knew everything about you. But upon preparation, I was astounded to how much I didn't know. So please, and one of the things that I actually noticed, that you worked night shifts as a pharmacist during your studies, your early career. Tell me about that chapter.
Thank you so much again, Your Royal Highness. It's a great honor to be your friend and amazing pleasure. And yeah, I think the first time we met at the IR Congress, and I mean, it was a great experience to be named one of the IR 50 young leaders, and you were doing the keynote address. I remember that exactly that time. And I mean, I was a young clinician coming from Armenia, but I wanted to say hi.
I'm glad you did.
Yes, and that's how it started. Yeah, I was born and I grew up in Armenia, and I did my early studies in Armenia. And during my student years, I wanted to, besides my studies, I wanted to work. At that time, it was not very usual, not a widespread thing that as a student you would work. Some of my friends did the same, but I wanted to be maximally independent. And I didn't want to take money from my parents.
Amazing.
And I said, no, I'm going to go work. And actually, before that, I think the first thing I did I think at the age of 16, it was with friends, we set up a DVD shop. It did not become a big business, but it was something like we initiated again with the same purpose. But then, yeah, I during my studies, the first years of the studies, I worked as a night shift pharmacist, 15 night shifts a month. $100 a month, I think. Something like that, it was the salary. But it was a great experience. First of all, at a very young age, you take a responsibility. And I mean, I think you are building your independence. That's, to me, it's very important to be independent and to take a responsibility. That was the thing, I think.
Amazing. But I mean, while you're studying to be a doctor, I mean, correct me if I'm wrong, usually it's a lot of study, work study time. How did you manage that?
I don't know. Somehow it happened. Like I would have a night shift, and every day, of course, going to the medical school. But yeah, it was tough, but I think
you just did
doable.
it.
Yes,
you just did it. You didn't complain.
No, I mean,
you just decided to do it, and you did it.
I'm tired.
Yes,
but,
exactly.
That's the life, and I enjoyed it, honestly.
Yeah. When I was reading your CV as well, I was also astounded. I mean, I knew you studied in your medical degree in Yerevan, Armenia. And I know you did some fellowships abroad, but I did not know the extent of it in 7 countries: USA, Canada, Germany, Taiwan, Belgium. Austria. I mean, that breadth of experience is so unbelievable. What a global health journey for you at such a young doctor or a medical oncologist to be able to expose to different health system. I'm sure that gave you a layered understanding and a different perspective of how different health systems work or don't work, for that matter. And so tell me, how did that shape your experience later on when you became a leader in your own country? And, what did you learn from all of that?
I think it was critically important. And the training abroad changes completely the overview. And I mean, it was an amazing experience, of course, in Armenia, and I'm very thankful for my university and all my faculty and the mentors, everyone. But when I entered the fellowship program, my mentor, because of whom I chose my profession as a pediatric oncologist, he told me, it's good to have a training here, but you need to study also abroad to see that like a different world exists and to learn and to bring back.
Fantastic.
So I started. At that time, there were the options were very limited, I remember. And I would sit, during the night shifts, again, now at the hospital as a fellow, I would sit and start sending emails at that time with very poor English all over the world, to every single institution, to every email I could find on the internet. And 99% of the time I was not getting any answers. And majority again, where if I was getting a reply, it was a rejection. And then finally I got my first positive reply. It came from China Medical University in Taichung, Taiwan. I didn't know even that China Medical University was in Taiwan. I just emailed to China Medical University and the professor there, and even I didn't know that the title was superintendent. I didn't know that it's the title of a director. So, but like the life brings very nice surprises, and he was a wonderful person. He sent me an email. He said, okay, I'm happy to accept you into the Pediatric Hem-Onc Fellowship Program. Come, learn. And then the follow-up email I sent, I said, also, in parallel, can I find another job to sustain myself, because it was not a paid fellowship. Then another email came from their educational department. They said, we are going to cover everything. Don't worry. So I went there. The first day I was meeting him, he asked me a question, do you want to do night shifts? I said, of course. These night shifts became kind of already walking with me. Yes. And I said, of course I want. But I didn't expect anything in return. He said, then you will be salaried also for that. So, it was an amazing experience. And I learned so much, and it was the door opening to the world for me. And then I returned back to Armenia, then went to St. Jude. Then I got another fellowship in Austria, St. Anna Children's Hospital. In parallel, I was applying for the Ulm University. There was a master in science in oncology, a program, 2 years program hybrid, and they had only one scholarship. It was close to, I think, 20,000 euros and the tuition. So I applied for that scholarship as well, and fortunately I got it, and from the European School of Oncology, and I went also to do this master's degree in Germany. Then while I was finishing my fellowship in Austria, I went for a survivorship congress. I have a cousin living in Belgium. He said, come to my house. We haven't seen for a long time. I said, of course I will come, but let me look if there is a conference at that time. And there was the survivorship congress by EORTC. So I said, okay, I'll go to the survivorship congress and I'll come visiting you. And I went for the congress and I met wonderful people there. The CEO, at that time, I think he was the director of the fellowship, or Denis Lacombe. And I talked to him and they had a position for the clinical research fellow. And they got me accepted. So right away I went to Belgium from the Austria. And I was applying also, I wanted to study in the United States. A friend of mine, it stuck with me this part. A friend of mine told me that when we were like in the room where all the EORTC presidents were there, he said, you know what unites all of these people? I said, what? He said, all of them, they had some part of the studies in the US. I said, maybe that I need to do then. So I applied for several fellowships. Some of them I didn't get, but the one I get, it was the ASCO, American Society of Clinical Oncology Life Award. So I went to, it was a big fellowship, a research fellowship, and I went to MD Anderson. I was fortunate by my mentors there, Marina Kanaplova and Hagop Kantarjan. I went there, I did a fellowship, postdoctoral fellowship in leukemia department. It was a life-changing experience, MD Anderson, the top institution, one of the top institutions in the cancer treatment. And it changed my mentality a lot also in regard of doing the things and the cancer research. And then while I was finishing, I wanted always to study at Harvard. I said, I'm going to do it. I didn't know how I was going to do it, but I was going to do it. So during my studies at MD Anderson, if there was a conference, I would fly out to Harvard and listen to lectures. I remember at ASCO, late Paul Farmer was speaking as a keynote speaker. I didn't know him. I just saw he was speaking. It was so inspiring. I messaged him on emailed him. I said, I want to meet you. He was already leaving. He said, come to Boston, we'll meet. So I went for his lectures. And then there was a program at Dana-Farber Global Health Program led by Carlos Rodriguez Galindo, currently the senior VP of St. Jude, another amazing person. So I went and met him, told my story. I said, I want to come. He said, come. So after the MD Anderson, I went as a visiting scientist at Harvard, at Dana-Farber Cancer Center. And then I returned back, but in parallel, I was doing some other studies. I took another 1 year at Harvard for the High Impact Cancer Research Program, and another 1 month I took at the School of Public Health of Harvard on the Global Health Delivery intensive course, very intensive, honestly, because it was from early morning to the night, but a great program, amazing program. And then during the COVID time, I did a Global Health Diplomacy course, executive education in Toronto, Canada. Again, it was a different kind of perspective. But these all kind of things, of course, shaped my overview and seeing the things on how are things done in different parts of the world. Naturally, you start learning. But most importantly, it builds your network and you know the people.
Yes.
Most important thing
is
people.
Yes.
Not the thing. Most important is the people.
Well, I want to unpack because you've said a lot in there. Number one, the importance of mentors. And I think in our part of the world, we have some mentors, but mentorship should be having a bigger space, actually. Because you had your first mentor in Armenia, who told you should go out. You're a young student. He opened your eyes to that you should be exposed and go into the world. And then along the way, you mentioned some mentors in MD Anderson, mentors as Dr. Carlos, and many others in Taiwan and so on. So that's one issue, the importance of mentorship. I think that we need to take a moment to show how important that was, because that mentorship sort of, in terms of the people that helped shape your journey. You went from one place to another thanks to these mentors. And so that's one. Two, the importance of, when we talk about inequity in global health, it's so important for other medical institutions to open their doors to fellows from low and middle income countries. I mean, you mentioned, of course, it showed your tenacity and resilience, not taking no for an answer. But the fact that you applied to so many, and the first one was Taiwan, really amazing. gave you that first opportunity. And I think, I know from the King Hussein Cancer Center and other low and middle income countries, it's so important, when you talk about achieving equity in global health, it's so simple. Open up your doors. It's so competitive nowadays. I know for even national doctors and so on, but keep that space for young, ambitious, talented medical students who want the opportunity to be exposed to top cancer care. So I think that really, you showed that a lot in your discussion, and I wanted to highlight that. It's as simple as that. Open up your doors. You want low middle income countries to achieve quality cancer care? Give that opportunity. Make a space. I know many do global cancer programs. This is one real concrete example how you can help accelerate change in low middle income countries. And I think from what you said, I really want to again go back to the fact that your personality, you really, you were, many people might be told, oh, why don't you go here? Why don't you do this and that? But you actually did it without thinking. You just went ahead and did it. And that says a lot about you. And also, I love the fact that you didn't only do clinical experience, you also did courses, executive public health courses in Harvard and later on in Canada. And I think that's so important because we all know now that delivering health is through systems. And the technical part is fantastic, but to access that, you need systems to deliver healthcare. And I think that was very important for you to have done that. And I wish so many medical students actually make sure to study also public health, because that's what gives access nowadays to receiving actually health services. At the tender age of 32, and I want to stress 32, it's a big deal, you became the head of the Pediatric Cancer and Blood Disorders Center of Armenia. And under your leadership, the center grew into the leading institution in Armenia and achieved cure rates well above 80%. Now, I want to unpack this before I ask your question. I know this is a big deal because when we had our experience in Jordan, when we tried to transform cancer care in Jordan, it was a tough thing to make change in a country, making sure everybody comes on board, to stop the naysayers, to move forward, and so on. It's a big deal. It requires tenacity, leadership, being a go-getter, and so on. And Armenia is a low-middle-income country. I would like to tell the audience, especially those who may be listening from countries who want to emulate your experience, especially that you're a low-middle-income country that achieved quality cancer care. Tell me about the challenges, the opportunities. How was it when you first started? And what were the foundational elements and strategies that you had to implement to get the change moving and then, of course, later on accelerating?
Thank you so much for that question. It's a result, the century is a result of a hard work of a great team. And we are really standing on the shoulders of the giants. So it has been done, and it was done through the work of the decades of work of visionary people, our mentors who built this up. And then we continued the work. When I was studying abroad and working there and doing a lot of some things, I mean, this idea always was with me, why don't we have the same in Armenia? I mean, this inequality was kind of hurting a lot. And I had this vision that I'm going to go back and we are going to change it. And we are going to make Armenia as one of the top destinations where kids all over the world could come and receive the treatment. That was the dream. So I think the most important, first of all, is to have a dream and believe in your dream. And then I returned back to Armenia, I think 2015, it was end of 2015. I mean, there was a lot of problems. I started working at the university hospital in a clinic with great people. Many of them were my mentors from the early years. And we started doing a lot of things, building on what already has been done. In leukemias already, like we had a lot of progress in lymphomas and in many other places. But there were a lot of obstacles, of course. And we had that dream, and I think that the second step is to have besides the vision, you need to have the strategy to implement this. And then, besides having the strategy, you need to do it. You can fail, you can have a lot of failures, but I mean, you are learning by doing. So you need to do the things. And one of my friends gave me an important advice while I was in US. He said, listen, I mean, at some point, stop just asking advice and just start doing it. Just get the things done, and it will continue. And we started doing this. The first thing I remember, one of the projects I did, and this comes to when we think that we need a lot of resources to make huge progress. But we got the first grant, it was $5,000 grant from Dana-Farber to build the psychosocial program in Armenia. And we did it. We trained 2 people, wonderful psychologists, and they became champions. One of them now is the co-chair of the PSYOP psychosocial program working group, and another one is has a leading role at the Psychosocial International Psycho-Oncology Society. So they became champions, but first of all, they championed locally, and we built that. And then I think it was critically important, and it is critically important, to have a great team, to build the team. Because, by bringing new energy and pairing them with the experienced senior people, and by allowing them to make a real change, to take a responsibility, this is what builds this vision, momentum. So when we were building the pediatric cancer center, we had at that time three different clinics in Armenia, and we did not need to invent a new wheel, because there were already existing great examples like King Hussein Cancer Center, like Princess Maxima, like when they united all the pediatric cancer services under one. So we said we are going to do the same. And I was fortunate and honored to be appointed as the first head for the Pediatric Cancer Center. So we merged it and we united everyone's efforts. So this was the first critical step for the center, to unite everyone under one umbrella. So we became kind of all together a team, no duplication anymore, and like all the efforts are going the same direction. And then, of course, the second most important thing was to bring young people and to educate them. So what we did at the university, medical university, we opened the first fellowship program in pediatric hematology oncology as a unified profession. It was the first time we were doing it. And a lot of people said, we might not succeed, but I was tasked also by the president of our university. He said, if you are going to do it, it should be the best one. I said, okay, we will do it. And so we opened the program. We took the best examples like St. Jude, Dana-Farber programs, American Board program. We did not need to invent a new program. We just took it and adapted it. And I said, okay, if we're going to accept the fellows, there must be best of the best. So we said the requirement is the knowledge of at least 2 foreign languages, and English is must, because you can't become the top like oncologist without the English, because today the language of science is English. And then they must do research. This was a kind of something new for us in Armenia. They must do research in order to complete the fellowship and must publish a paper in a highly indexed journal. So this way, we were able to attract top of the top students from the medical university. In 5 years, we trained 15 fellows. And I mean, majority of them became like champions, and now they are at a very young age. Now they are leading the have leading roles in the international societies. They became PIs. Like my first fellow, Rosanna, I'm very honored. She's now leading she's the PI of the first clinical trial within the POEM group. On osteosarcomas, 27 centers from 9 countries. And a few days ago, I was on the communication. There was a program with international organizations where she's leading the effort of transferring our knowledge as a twinning partner to 3 countries. And I received the email that 2 European countries want to join. Armenia leading the effort. So this kind of, you need to give the most talented young people a real responsibility and hold them accountable for that.
Yes.
And you give the tools, you give the independence, you empower them. You tell them, you go study, you bring back your knowledge. We had 0 brain drain. 0. In our field, we have 0 brain drain.
Now.
Just the opposite. Yes, opposite. We had fellows coming from other countries.
Fantastic.
And I think, the thing is that when you are starting in low-middle income countries, I mean, you get so many advices. And these are usually, people really care what you do. But they are giving the advice, many of them are giving the advice from different contexts. So one of my friends would tell me, you are going to do this. Where are you going to put your toxic waste? I said, first of all, I need to have the toxic waste.
Yes.
And I'll find a way where to put
Yes.
it. I'll read it. I don't need another student or another fellow to come and do an assessment which will take years, because I see that every day we are losing the patients.
Yes.
People are dying.
Yes.
We cannot stand this. The time is the most important critical thing. We need to treat the time we are treating the money, because patients cannot wait. You cannot just sit and wait until you get another beautifully designed strategy. The strategies already exist. You just do it.
Yes.
That's the strategy. You need to, it's also very important that you don't think that you are a kind of a second-tier country, or your patient should be kind of treated like, because you are from low-middle income country, then you need to be treated different way. No. We must make sure that we have the same chances of delivering equitable care to our patients, regardless of geography. And that's what we are doing. When I returned back, and I should credit here an amazing Jordanian friend, Ibrahim Kadumi.
Yes.
So I returned back to Armenia. I had 0 experience with neuro-oncology, but we had patients. We needed to treat them. I called Ibrahim. I said, Ibrahim,
help.
I need your help.
Yes.
Every single case we are receiving, and we had a wonderful fellow who became, now one of the most talented, I would say, not in Armenia, but really globally. He can, I'm sure, compete with anyone in the world with his knowledge and depth of knowledge and care, and also care. So I said, he is going to discuss with you, send you every single case in neuro-oncology. This way, we are going to get the things going. And then he was an adult oncologist fellow. At that time, we did not have a pediatric hem-onc fellowship. So that's how we did. And then the second wave, when we had the fellows coming in as a pediatric hem-onc, we paired our new pediatric hematology oncology fellow, Julia, with him. So this was a transfer of knowledge. last year or the year before, so I met Ibrahim. He tells me, how is doing my second most favorite Armenian? He's telling to me. I said, then who is the first one? He says, Julia, of course. She said, yes. He says, she became an expert. She did a fellowship with St. Jude, this neuro-oncology fellowship. She became a top person and came to, in Armenia again, we established a multidisciplinary team. Now, just with the numbers, like I think, if I'm not mistaken, in 10 years, we had 75 patients, I think, in neuro-oncology. But last year only, we had 45. In the earlier reports, we had, because patients were going abroad.
Yes.
Or we were missing them. But now, and Julia now is leading an international society. It's called, she's the co-chair of Neuro-Oncology Research and Care Network. So, I think she's 30 or 31.
Amazing, amazing.
This is like how, we don't need to lose the time.
Yes.
We need to bring all these great people. And I think also it's very important to communicate properly what you are doing. This was also critical.
Yes.
Because when you communicate you are doing something good, or you want to do something good, a lot of great people want to become part of it.
Yes.
So the communication is critically important. If we didn't communicate this properly, these great old fellows would not come and become part of our team.
Yes, yes. If I may, because you've said a lot.
Yeah, sorry.
And no, don't be sorry, but I just want to keep up with you because there's so much to unpack there. Number one, this idea of truly, like you said, empowering young people to take leadership. Unfortunately, in many health systems, low and middle income countries and others, actually, we have been lagging in letting young people lead the way. And like you said, young people, they bring new energy and can do energy and so on. So if you have someone capable, let them lead. Don't wait for the typical hierarchy of age. This person has to be this, and, how can you have a leader age 32? He has to wait to get other people's turn to take leadership and so on. I think this needs to stop. We need to get more young people on the table. And I know when I was president at UICC, there was a definite decision to get more young people to sit on board. And I think this needs to happen more and more. So that's one. The other important thing that really want to unpack also is the idea of the naysayers, the people who keep saying it's impossible, it's difficult. It's amazing example, what about toxic waste? And then you say, well, let's have toxic waste first. And I remember having that when we started as well. People putting obstacles. Like you said, they meant well, but before we start putting obstacles, as if saying, don't start, you're going to face so many things, give up and go. And the fact that you believed so much in equity, that you decided that, I don't want to see, as a medical doctor, to see only the rich kids get treated. I want to be able to give access to every single child in Armenia to have access to quality care and have their chance for cure. Which was your driving force, I think that's number one. And to be able to say, and I love your idea, just do it. I think we need to, I hope Nike doesn't sue us because you really have taken their slogan to heart. And I know that because when I wanted to start my global health podcast, I remember chatting with you and you just told me very casually, oh, just do it, let's do it. And I did it. This idea of just taking that first step, one step after another, and suddenly you have this amazing cancer center now in Armenia saving lives. And the same with us. If we were to think of every possible difficulty that we were going to face, we probably wouldn't have started. This idea of just do it. We have enough knowledge. Start by doing. I just so love that. And I hope our listeners would really think about that because the knowledge is there. And again, like you said, the mentors and people willing to help, like Dr. Ibrahim Qaddoumi, opening up, his experience to a fellow in Armenia. People are there. People love to see success and to join the bandwagon of success. And I love that experience. And it kind of mirrors our own experience back in Jordan. But also, do you have, now that amazing cancer center performing fantastic and reaching cure rates and so on, do you do bone marrow? Do you perform bone marrow transplants?
Yes, while you were talking about the people who did not believe, it would be a great example on how we started the transplant program. Yes, we do. We do bone marrow transplants. We're having patients from abroad coming to Armenia to get the transplant. And, when we were starting the transplant program, I got, again, a lot of things like from all over the world, and these people were giving this advice from their kindness, but this was, to me, it was not the right advice.
Yes.
They were telling, oh, you don't need to do the transplant now. Where is this? Where is that? I said, no, stop it. We need to do it. Because if you are of course you may have more toxic death. Of course you will have when you are starting. Yeah. But when you don't do that, everyone dies who needs it.
Absolutely.
So it's like you need to, put on the scales what you are between what you are choosing.
Yes.
So we said, no, we are going to do it. There were a lot of skepticism at the time. Even some of colleagues were telling, oh, this is, because when we were starting with the program, there was a great program with whom we kind of became partners on doing this, Cure to Children in Italy, led by Lawrence Faulkner. He starts doing the transplants program in low-middle income countries, and he brought this example to us. And the idea was to start with the benign hematology and then go for the malignancies like leukemias. And we did that way. And we succeeded. We sent our young doctors abroad. So, for example, our transplant physician Manesh went and stayed 6 months in India. A huge program, and she observed and participated in many transplants, and we brought back the experience, and we started doing this. And now we do transplants for leukemias, and then adult also transplants in the center are going very well. So, you need to believe. You need to believe on yourself, and you need to do it. And first, as I mentioned, you need to see between what you are choosing. Between two evils, like you said. People were dying anyway. Yes.
So you have to start somewhere, and you have to start by doing. And look, where are you now? And I think this is the most important lesson, to be honest, for many people who are listening. Like you said, do not tolerate inequity.
Yes.
That's one. Believe in your vision. Bring people, like you said, communicate this to everybody so that you all have momentum to move this forward. And don't listen to the naysayers, and just start by doing. I love that. But also, I remember you told me, of course, in the team you've been having doctors and so on, but the role of nurses. I'm a mother of a cancer survivor. And I remember, by the way, when we had to move from England to the US. And it was a big move for us because my son was still during treatment, but I wanted to prepare to be with Dana-Farber, actually, to move there so that just in case he relapses and he may need a bone marrow transplant. I was actually given in 1999 the advice from a British doctor that you really need to be in a program that has big volume. And when I went there, I'm ashamed to say what was my thinking at the time, but it was a reflection of how we all thought about nurses. We never saw oncology nurses leading programs and having that higher qualification. I remember when I arrived there, there was this nurse, and she met us and talked to us and so on. And she finished, and she said, okay, come back again. And I said, wait a minute, we've just crossed an ocean from England to come to the US. Where is the oncologist? Because at the time, we never saw in our own countries the way nurses are treated, the way they are given more responsibility in actually delivering care. They were very much like just support team, right? And so later on, of course, this nurse, Andy, became everything to us. And we trusted every word she said and so on. And it opened up my eyes how the world has really, in certain countries, they've really appreciated the role of nurses and what they can do in oncology care specifically, and the countries who still don't, and what a missed opportunity. So I'd like to know, in your center, what were your views on that?
Thank you so much for this question. This is really, critically important question. Nurses are, I think, one of the most, if not the most, critical part of the cancer care. They spend more time with the patients, and it all so much depends on the nurses. And I think for having a great program, a comprehensive program, a world-class program, you need to empower your nurses. You need to educate them. You need to give them a chance. And they're great people. They want to, they see also all these things happening, and they want to make a change as well. I remember when we did the first training for our nurses, we invited nurses from American University of Beirut. So when our nurses, it was several days program, a full day program, and when our nurses were doing a pretest, majority of them failed the pretest. On the last day, when we were doing a post-test, every single one got the highest possible marks. They excelled. And it changes so much. A few years ago, when we had helped our nurses to initiate the Armenian Association for or Armenian Society for Nurses in Oncology, Hematology, and Palliative Care. And on the International Nurses Day, there was a conference at our university. I was honored to give an opening address. And when I entered the auditorium, which is like a 500, I think, the last time I have seen that auditorium that full when you were there giving an opening address. So people were standing or bringing other chairs. So the auditorium was full of nurses. That was amazing. Yeah. And then last year, we had a congress, I think it was congress in Amman for the poem. And I got this news that in 9 or 11 Armenian nurses submitted their abstracts. And I think per country, 1 or 2 were getting selected to get a scholarship or so, something like this. But all those were selected our nurses Armenian, and they decided to come on their own.
Yes.
And for a small country, low middle income country, for a nurse, it's kind of very difficult. The nursing part is critical. Yeah. We need to empower them. We need to give them possibility to develop themselves, and they will do it. We set up the nursing educator program first time in Armenia. A lot of people were saying, "Oh, what is this?" But then we saw the change. I mentioned these abstracts when they were coming and presenting. And I think in general, I talked about the physicians' empowerment, nurses' empowerment, psychologists. But in general, when one example always goes with me. It's I think it was Kennedy when he went to
Reagan. I think you're thinking of President Reagan who went to NASA.
Yes.
Yes.
When asked the supporting staff,
the cleaner.
The cleaner, what are you doing?
Yes.
What are you doing? He says, we are putting a man
on the moon. Yes.
So that is always thinking with me.
Yes.
Your team should be a team.
Yes.
Every single one on the team
yes.
should be integral part of the team.
Yes.
Everyone.
Yeah.
They should have the same mission and vision. Yes. And this way you will succeed.
So you fixed the cancer center, great, but access to care also requires money, resources, lots of it. And you could not tolerate that some children do not have access to treatment simply because they don't have the money. So, of course, typical you said, okay, we're going to do something about this. I'm going to start the City of Smile Foundation to be able to get donations from people who hate cancer, people who want to support the center, whether locally or abroad. Can you tell us about that?
Actually, City of Smile, it's a joint effort between our team, and I'm one of the founders. Well, I remember back in the days sitting at MD Anderson when I was doing my postdoc. During the lunchtime, I would sit and do the design of the logo of City of Smile Foundation, how it would look like. But I can say that right now, not a single, and for many years already, not a single child and a young adult up to the age of 25 stayed without proper treatment in Armenia. And in Armenia, I mean also foreigners who came to Armenia.
Yes.
For the treatment. We had that vision and like that, yes, we should not tolerate this because we're seeing that this inequality, it kills really. I mean, it kills you when you are a doctor and you can't do anything, it kills you as a person, as a doctor. So we wanted to change it and we did it. We built the foundation, City of Smile Foundation. It's a great foundation, and it's an effort of many people, many great people who different part-time of this journey joined and made it happen.
And I remember when I came during my visit, I met the Harvard Club of Armenia, who were very supportive of the City of Smile Foundation, which you also co-founded.
I was not
You were not the co-founder?
But I was owner. I mean, I was fortunate for 2 years to be the president of the club. But yeah, actually, our executive director of the City of Smile Foundation, a very dear friend of mine, Esther. I started knowing her from the Harvard Club.
Yes.
And she has a Harvard business degree. So I remember the day I went and asked her to join the foundation, which she did. And it was a critical moment because she's an amazing executive director.
And I remember we wrote to each other and I shared with her our bylaws.
Yes.
Remember? We had discussed how it's done. And, I want to give credit to St. Jude at the time, who really opened up their books and let us literally almost copy and paste but like you said, do not reinvent the wheel. Take the best of the best. You can adapt it, which we did, but it gave credibility and gave us the confidence that this is the right way to go about it. And I remember having those conversations with her.
And you gave me the best of the best advice.
Which was?
You said, never hesitate or feel bad asking money because you are not asking it for yourself. You are asking it for kids. That kind of became for me as a guiding principle. Yes, and so I would go and ask.
And, I have to give credit. I passed it on from the late Richard Chadiak of St. Jude, who told me, he said exactly the same thing. Never hesitate and never feel shy about asking money because you're not asking for yourself. So that made such an impression on me, and I passed it on. And I still pass it on to others. And, to this day, I have no shame asking people support for causes that are very impactful. And then what was outstanding also, I felt, that you kind of became like a national reformer in health of Armenia. So you realize there are certain things missing in the landscape. Yes, you have now the center, you're performing bone marrow transplants, you're treating kids and so on. But you also co-founded and coordinated the Armenian Association of Hematology and Oncology. So you started that. And you went on to establish and lead the Immune Oncology Research Institute. I know you mentioned earlier you had a stint of a fellowship at EORTC, the European Organization for Research and Treatment of Cancer, which, by the way, I'm a proud honorary president. So did that spark your interest, or what was the impetus for you to start the research institute?
So first of all, about the association, we established it with our doctors, with our oncologists, and we had that goal that we are going to make a community of professional society, which we will start making changes also on the professional development, bringing conferences and making Armenia visible on the map of the globe. And we did it. A lot of things happened. And then about the Immuno-Oncology Research Institute, I think the EORTC was my first research kind of work. And certainly it made a lot of impact on me. And then I did the postdoc at MD Anderson. It was another amazing experience, especially following, I should mention that huge impact on me, even maybe, not directly he was telling this, but just observing him, how he's shaping the world, Hagop Kantarjian.
Yes.
It was an amazing experience for me, and just how he's making the world change, these grand rounds and all these things. And then, yes, I wanted to do research because, first of all, there is a nice expression, there are two very nice expressions I'm always kind of following. First one is shoot for the moon. It's even if you do not reach there, you will stay among the stars.
Yes.
So in everything I'm doing, this is a kind of one of the guiding principles. The second one, when we're talking about the research, it's like what gets measured gets done.
So
what gets done, yes, builds trust. So the data. This is when we are talking about bringing the data in. And I remember we were starting one of the first research projects we were learning. It was to collect all the data for 25 years in Armenia. And we got a small grant and we made a registry. So we wanted to measure what we are doing. It was critically important. And then we partnered with the St. Jude registry and put everything there. So this kind of sparked, a lot of interest. And about the Immuno-Oncology Research Institute, we wanted to do something, to do research. And I was having this discussion with some of my friends. And I remember I got a call from a dear friend of mine who again made a huge impact on me. In 2015, there was a conference in Boston. So I was a young Armenian attending being in Boston at that time. And the keynote speaker was Armenian philanthropist and the biotech leader, Garo Armen. So he was the keynote speaker. He established the Children of Armenia Foundation, hundreds of $millions invested there, and also established one of the leading immuno-oncology biotechs, Janus. And I went there at the end of the conference. The auditorium was full. And at the end of the conference, I just went to say hi. I came and said hi to you. I went and say, hi, I'm a young Armenian researcher now at Dana-Farber, a visiting scientist. And he said, wonderful, great. Can you leave me your card? That's it. And then half a year later, I'm getting a call from him, from his assistant in Armenia. He says, Dr. Armen is coming. He would like to meet you.
Unbelievable.
And we became friends. Very dear. He's a very dear person to me. And I think it was 2021 or so. So he got this news that I want to do something in this, and I was depressed that we are not going to, I think it was after the war also, kind of, I was, it was
down.
a difficult period. So I got a call from him, and a friend of mine told him this situation. So he called me and said, I know you want to do research. I know you want to make Armenia kind of a place also for research, for breakthrough, and I'm going to help you. We will give you a grant to do research. And so you grow. I said, I want to build the institution with this grant. Immuno-Oncology Research Institute. I said, do it. Patients cannot wait.
Yes.
Do it. Let's bring the most breakthrough, innovative medications to Armenia. Let's do the best clinical trials we can. And we started. Yes. And lately I was sitting with the team. And, sometimes you are having a moment of up and down.
Of
I
course.
think it was the time of down. The team was, this is not going very well. I said to our scientific director, Samuel, I was talking to him. He was the neuro-oncology guy first. He was started. I said, you are for sure I can say that he's a genius, but also a wonderful person and physician and scientist. I said, when you were a child at the school, you got the second place in the International Olympics on chemistry. Why do you think you cannot make a breakthrough? Why do you think if you are in Armenia, you are kind of less than anyone sitting anywhere in the world?
Yes.
So, I think, and when I was looking really at the team we had in the room, all of them, amazing people, but also, really, really great physician scientists. Very young, but extremely promising. Our first-year fellow, Ellen, last year, she did the first ever oral presentation at ASCO. The first-year fellow.
Amazing. Yeah. Just, that tweak of the psyche that we can do it. We've all studied, we've all been, and I think we went through that as well. When I was the head of the foundation, in the beginning, we'd go to conferences and, we would just sit quietly and listen. And then we said, wait a minute, we are transforming cancer care in our country in a low middle income resource setting. You know what? Some of these people are theorists. We were actually doing it. So we have the right to talk about our experience, and we should feel that we can. And we have a lot of great ideas to speak about. And it was very important to me that my team would not see themselves as less.
And I was observing that.
Yes.
I was observing that. I clearly remember at the UICC meetings.
Yes.
Your team coming. I remember Mace, Rana,
yes.
would come and stand and make the great comment.
Yeah.
And not like, I felt that as well.
We
and
broke
I learned
that psyche as well. I said, look, you're just as educated in theory, right? But the most important learning comes from on-the-ground experience, because we succeeded, all of us as a team, to transform cancer care. And that was a big thing in moving the team forward. You're also widely recognized as a bridge builder, someone who connects nations, peoples, regions, entire system. I saw you now in the conference in Cairo. Everybody knows Dr. Gevorg. You were elected president of two major international pediatric oncology societies. One, the International Society of Pediatric Oncology, SIOP Asia, continental branch. And I'm the proud honorary president of SIOP. So I love that organization. And the Pediatric Oncology East and Mediterranean group called POEM, bringing together 28 countries and 110 cancer centers. Later, you were elected as co-chair of the St. Jude Euro Regional Advisory Committee, spanning 13 European countries. Big experience. And remarkably, within just 10 months of your SIOP Asia presidency, you and your executive team appointed 42 national ambassadors. This is huge and an incredible model of regional empowerment and collective action. Tell us, how did you achieve that? And specifically, I want you to be speaking to the young global cancer leaders who may be listening to this podcast of what leadership skills should they have, or if they don't have it, should cultivate it. And how important is regional collaboration?
Thank you so much, Your Royal Highness. I think it's like the critical part of the leadership. I'll start from there. I think is just get the things done. You need to do it. You need to do it by doing it. Just get the things moved, because there are beautiful strategies written, like thousands of millions of pages of documents produced every year. But the critical part is, do the things happen?
Yes.
Like
Start ticking the boxes.
Yes. So you mentioned about the national ambassadors. This was not my idea. This was the idea of, another great person who was the past president of SIOP Asia, Hiroki Hori, when he was like finishing his term, he said, I have this great idea. Let's make it happen. We did it. And it's like, you just take the paper, you...
Tick.
Yes, put the countries, put the names, who do you know, start calling or messaging, work with the people. I think the critical importance also is to work with the people.
Yes.
I love working with the people. I love to see their success. And I love to observe this. And to give the credit, to give the possibility, to give the freedom to create and to innovate. This is critically important. But also, of course, to keep them accountable. So creating these possibilities is of critical importance. And when you do this, you see amazing things happening.
Yes. Yeah.
And I was so fortunate to work with amazing human beings in every place you mentioned, that they were giving me possibilities.
Yes.
That they were giving me opportunities to do the things.
Yeah.
No one ever stood up and said, how old are you?
Yes.
Or, how big is your country? Or, I didn't have this kind of experience. I was really fortunate. I was lucky to be surrounded by this kind of people.
Because you project this positive energy. That's the thing. It's always so much more accessible and attractive to work with someone with a can-do attitude, right? And you project that. So people, of course, they want to work with you. And you're also open to encourage. You also mentor me. Yeah, you talk about me mentoring you. You have mentored me in so many ways as well. And we need more people like you, Dr. Gevorg. But what about the regional collaboration? How important is that in sort of scaling up cancer care in particular regions?
Answer two ways. Of course, regional cooperation is important, because when you are in the same region, you are kind of facing the same problems. You have the same social, sometimes you have the same social structure on social beliefs, or kind of on the historical context, you have a lot of similarities. But I think in general, cooperation is critically important, regardless of region. When we are talking about Asia, come on, Asia is like,
yes,
it's huge. It's huge, like just the size.
Yes.
Let's take it. But while we talked about so many regions. US is in another continent. Then Asia is here. Then Africa, Europe, Australia, South America. This is like, and you can learn from everywhere. I think the critical importance here is to be open to collaborate.
Yes.
Both regionally and internationally, because we can learn so much from each other. And we don't need to invent the wheel every time.
Yes.
There are so many wheels already invented. We don't need to start our own something which has been already done somewhere else.
And also there's a lot of learning from things that didn't work.
Yes.
So you kind of gain time. Why try something when somebody else did it?
Of course.
That has the same landscape or ecosystem of cancer care with all its challenges, let's say. You say you can, not waste time. You know that they've tried this, it didn't work for various reasons, and you move on to the next. And then I want to come to the fact that, I don't know how you did all of this. You're only 38 right now as we speak. I mean, your CV is really, I thought somebody of a 60-year-old would have done all of that, but you did it. And if that wasn't enough, you then decided to become a leader in global cancer communication. You are the founder and editor-in-chief of OncoDaily, the largest oncology media platform in the world, a global community that has democratized access to reliable, unbiased information for millions of professionals, patients, organizations, becoming of the voice of oncology worldwide. I mean, did you just wake up one morning, oh, by the way, I want to start this? I mean, I personally always felt that health and cancer communication rarely escaped the walls of conferences we go to. I always felt we spoke to the choir, people who agree with us, and also, not all voices were represented, quite frankly. Did you feel the same way? Was that the impetus for you to start something new, different, and more inclusive?
I think it's, again, about the dreams and about believing in yourself, in your team. One of them, yesterday, I think it was yesterday, I saw a post our team made on the news about that it's already 1 year that Cancer World joined OncoDaily family. So in the past, I would like, Cancer World it was the largest, and it is the largest European publication, and to have just a small piece in that magazine would be a great honor. But now when we acquired it, it was kind of a moment when I felt, oh, really, we are doing something, I think, big. But 2 years ago, it was 2.5 years ago, I said, I had always this kind of idea. Why in the majority of media and the communication platforms, it's there are key opinion leaders, let's say 50 or 100 people, and they are always there. So the other part of the world does not exist. And I said, we are going to change this. We are going to give the voice to everyone. And I had this idea and how to do it. So I called my cousin. I said, he's big in this he was big in the economy media in Armenia. And I said, can you make a website for me? He said, of course I can. What's And we co-founded the OncoDaily. We had only one employee, a part-time student, who I was guiding, you do this way. And we started. And then right now it's 40 people working on the staff. The first year we had 23 volunteers who joined from all over the world. 23 volunteers who were our managing editor. I talked already about her, Ellen. She was at that time a student. She's now a second year or third year fellow now of oncology. At the age of 20, she was managing, to 21, she was managing 20 more people. Excellent way. And then my team members, two of my other amazing students who became later on fellows, they joined also from the beginning. One is now our senior VP, Shushan, who is she was a fellow when she was co-chairing a committee at PSYOP. She was a fellow. Another very extremely talented person. And Amalia is leading the research and intelligence unit, an adult oncologist, extremely talented again. So the team is we were attracting very talented youth from all over the world. But the average age at OncoDaily, if I'm not mistaken, is 22 or something. And then it became really the first 3 months we were operating on LinkedIn, our engagement metrics was several times higher than, let's say, New York Times.
Imagine, yeah.
So, it just happened by doing. Yes. Did we know how to do it? No, we did not. We just had an idea. We had the vision that we are going to make it happen. And we did it.
You did it. This is
Last year, I was giving a opening remark during, we established the Yvonne Award ceremony during the ASCO annual congress. We do a side event. The first year we had 1,200 people. I said, look, ASCO is 50,000 people coming and there is no party. Yes. I was part of the leadership development program. Yes. And the first thing I said, we were tasked to give some, to explore possibilities for networking. I said, we don't have a party at ASCO.
Yeah.
And everyone started laughing. And I said, okay, I'll make it happen. We did it 1,200 people party in Chicago.
Amazing.
And, yes, it was, the first time, recently I was talking with a friend of mine from US. I said, first time when I came to US, I was on the way to St. Jude training. I slept at LaGuardia Airport. I didn't know how much it was going to cost. So yes. I was keeping my budget on my pocket. I said, no, yes. I'm going to not overspend on the hotels.
Yes.
And I didn't know that years later I'm going to establish, we registered OncoDaily and we established it in US. I didn't know that I'm going to
suddenly you're the one holding the parties. Yes.
Yes.
Amazing. And I have to tell my viewers, between all of these things, all these institutions that you're running parallel, actually, you managed to marry your wonderful wife, Lilia, and your two lovely daughters. And I know that Lilia has to come to conferences with you just to be able to see you. It's just wonderful to get to know her.
Thank you. It's if I'm,
yes.
It's the most important achievement of my life. Lilia and my two beautiful girls, Charlize and Letizia. And yes, I mean, it's so much travel and I want to spend more and more with family. Lately, Charlize told me, Daddy, please just stop traveling that much. I miss you. And it was so kind of...
You feel yes, guilty. I know.
So I said, but yes, we try with Lilia to travel more together and to take the kids with us.
You have to make time for that because they grow so fast. Trust me. I know what I'm talking about. Make sure that you don't miss that boat. A lot going on with global health right now. We're certainly at crossroads. What are your thoughts on current and future development?
Yes, we are living in a difficult period of I think, history. Not only in healthcare, but it's also globally. A lot of things are going. But I'll focus on the healthcare. I think the critical thing here is number one is transparency. Transparency and accountability. We are, as a physician, you know that you can make a lot of mistakes. And this is but the important thing to be transparent with your patients, even when you're making a mistake, you need to be transparent. Then they will trust you.
Yes.
It's the same also with the global health and with what's happening around. We need to be extremely transparent with what's happening, where we failed, where we are not doing it right. Because when we are transparent, people would understand and they will give hands.
Yes.
Maybe someone will help with this one, with that one. Of course, we will have a lot of criticism, but that's okay. That's okay. We are human beings. We can make mistakes. And then I think the most critical important thing is we need to deliver.
Yes.
We have millions of pages of documents written, the most beautiful strategies, but we need to deliver. We need to implement. This is critically important because when we deliver, people see it and it builds trust.
Yes.
That's critical. Transparency, accountability, and delivery. Just get the things done and communicate it properly.
Yes.
Communicate it with the world, what we are doing. I think that's an issue in the global health now.
Yeah, totally agree. And we've seen that during Corona, remember?
Yes.
Those actually female leaders who were much better at communicating, like you said, the mishaps, the challenges, and so on. People trusted them and they went along with their journey and they understood. So communication is certainly key. And like you said, transparency.
And also, I would add, taking the responsibility.
Yes.
Both for the success and for failure.
Failures, exactly.
This is the critical part. I always remember this part on the Titanic movie.
Yes.
A beautiful movie, a drama. But the most important part, what I learned from this movie, is the part when the captain stays in the boat.
Yes.
He takes the full responsibility of that.
Yeah.
Leader must take the full responsibility of the failures.
Exactly.
First of all.
Yes.
For the successes, let the other talk about this.
Yes.
But you need to take the responsibility for the failures. Then you will be able to surround yourself with the best of the best.
And lead. Yeah. And astoundingly, with all of this going on, OncoDaily, the Cancer Center, you name it, all the initiatives and the societies you're presiding on, all the ones I've listed, I know you still have bigger plans, not publicized yet. So I'm booking you from now for another episode very soon, inshallah.
It would be a great honor, Your Royal Highness. Thank you so much for having me here. I mean, thank you very much for your friendship and mentorship throughout all these years.
And thank you, Dr. Gevorg. And I thank you on behalf of myself and all the listeners on Global Health Podcast for this very inspiring interview. Thank you so much.
Thank you.